Of opportunity where life moves fast. But as families grow across cities and time zones, the responsibility of care becomes more complex. Age fragments. But care today is often fragmented. Different providers, different systems, little coordination, leaving families to manage when they need support the most. Gericare was built to change this, founded by geriatricians with over 150 years of combined experience in elder care, creating India's first integrated continuum of care model for senior citizens. A system that brings together hospitals, skilled nursing facilities, rehabilitation, home care, and senior-focused clinics, all connected, all working as one. Following the success of our first Bengaluru facility in Alsur, Gericare now brings this integrated model to one of the city's fastest growing regions, Sarjapur. Because peace of mind for families comes from knowing that care is always present, day or night. We are grateful to the Honorable Health Minister Shri Dinesh Gundrao for his support and encouragement for the launch of this new center, and to Principal Secretary, Health and Family Welfare Department Shri Harsh Gupta IAS for his august presence and inaugurating this facility today.
Good morning everyone. It's a real pleasure to welcome all of you. Today we opened the second skilled nursing facility in Bengaluru. The Bengaluru has been a special for us in many ways. It feels like home. The city has understood and embraced the need of structured elder care, and that gives a lot of confidence, and we continue to build the care here. The warm welcome to our chief guest, Sri Harsh Gupta, IAS Principal Secretary, Health and Family Welfare. Sir, we are honored to have with you us. Sanjay Murata from Narayana City. We are looking forward to welcome Honorable Health Minister Sri Dinesh Gundrao, who was very keen to be here. Due to an urgent travel requirement, he could not make it at the last minute. We remain grateful to his support and encourage to Gericare. A special acknowledgement staffs who are here today. You are the backbone of our organization, and warm welcome to memorable press and media. At Gericare, we are not just building a facility, we are building a system care. India's senior population growing rapidly, but the care is largely fragmented and mostly hospital-centric. And the reality is that most elder care happens in outside hospital. That is where the gap exists. Our approach is geriatrician-led continuum care of connecting clinics, hospitals, home care and skilled nursing facility like this one. This is missing middle of the healthcare system. Just about 1 year back, we started the first facility in Alsur. The response we saw that is told us very clearly that families here looking for a kind of care. Today, with our second facility, Sarjapur, we are taking that forward. This center brings together what elders truly needed, closer to where they live. The community clinics with outpatient consultation, adult vaccination, physiotherapy and diagnosis and pharmacy. The dialysis care we created is a daycare and stay care services, and home care in surrounding areas with nurses and doctors available at home. Because care has to be continued, it has to be accessible, and it should be a feel close. Bangalore is an important city for us. Over the next 18 months, we hope to expand further facilities. And what drives us is a simple belief: elders deserve not just the treatment, but continuity of care. Not just a long life, but better quality of life. Thank you for being here with us today.
Very warm morning to all of you. Dr. Lakshmipati Ramesh, founder and MD of Jerry Care, Dr. Sanjay Mehrotra, Senior Consultant from Narayan Vidyalaya, Dr. Ravi Shankar, President of Jerry Care, all the other senior staff from Jerry Care and all others who have come for this, occasion. My purpose to travel here was to basically understand that what government can do for this sector by bringing some policies so that this care reaches the larger masses. Anyone who has had a weak senior in the family can understand the trauma they get through, helplessness what the caregivers go through. And in that regard, facilities like Jerry Care, which provide not only care home, but home care. So those are very, very apt facilities. These need to be promoted, and our challenge is to find out how do we promote these facilities in a much larger way. Very frankly, the Jerry Care facility at present, the costing cannot be afforded by many. So how do we bring out, the policies which make it affordable for people? It should not remain like a financial burden. And how do we bring policies that is, what we use the word care. Perhaps in any healthcare, care is very critical. But I believe or I feel that care for the elderly who are dependent on somebody's care, attendant, that is the most critical aspect, because that person who is the receiver cannot even express because they know that they are dependent totally. So they tend to get, undergo through neglect and abuse at times. So we need to, how do we create this system which, strengthen in the society this huge growing need. All of us recognize that this huge need is there. So we at the government level, of course, there are different programs, national programs are there. We take care of the preventive aspects, especially we take care of the curative aspects. Now, this particular sector, when your preventive has failed, your curative has failed, and a person needs care. So, person needs to be brought to a care home, which I feel should be like in our social context and the way it is resource intensive. It should be like a short stay period. People coming to care home, they are brought only in acute phase, or when the family needs support at that time for a short period. Then they are again integrated back into their family and the society. And this other thing, at home care, what your services provide, that needs to be really strengthened. That is really a challenge. How do you this whatever we do in our policy, we create nursing cadres. The nurses become like small doctors. They would not like to touch the patient or do anything. And then, people who are taking care of elders at home, for them one is to take care of the elder at home, then to take care of the elder one nurse, to take care of the nurse one more person. That is such a, practical challenges are there. So how do we create a cadre of, minimally trained, those attendants basically with compassion who come and take care. So that's a challenge at Government of Karnataka level. We are contemplating, and I request all the Dr. Ramesh and others who have been involved in this thing to come out, please interact with us. What can government do to, act as a catalyst for such policies? For example, I was just wondering, can we have this Arogya Karnataka scheme, Ayushman Bharat Arogya Karnataka. Mostly it is linked to certain medical procedures. When you require some procedure to be carried out, you get admitted to the hospital, it covers the expenses. Government of Karnataka, for all of your knowledge, it is covering a humongous amount of population. Almost 70-75% of the state population, Government of Karnataka covers under that scheme. We almost spend 2,000 crore per annum. So I was just wondering, what if we bring a small variation in the scheme and then we have to develop it with people like you? Years that cost so that they can get some relief and support those who are suddenly if they need some acute care. I hope that the drive with which the founders have started, the drive and the sentiment and the passion remains ingrained in the staff who work with you, so that it really, keep on touching the lives of the people who come in contact with you. Thanks a lot.
To Mr. Shiv Shankar, who invited me, through Mr. Ramesh, who lives in our community where I live. And of course, thanks to Mr. Ramesh and of course the chief guest, Mr. Gupta, who is a senior liaison officer. I am, as a cardiologist, who mostly deal with, people who of a certain age would get heart disease, which is the most prevalent disease in the country and all over the world. And all of us who are probably consider ourselves still not geriatric, but we are going slowly towards that. And I think the care compassion which is required in any field of healthcare delivery requires more specialized kind of infrastructure and a specialized training for people who provide this care. And I think as a doctor who sees of a certain standard of care given, and there are various standards of care you see all over the world. I see facilities starting very brightly and very smartly, but the most important part for delivery of healthcare is always the quality, which we lack all over the world, all over the country. It's probably our nature that we start with a bang and then we lose our quality. The one reason for that also is there is an overwhelming need for care. We are not able to fulfill the requirement because we get overwhelmed with work. The need is so much. And I think a care like this, of course, where you have an intention to produce more and more centers where the care to, as Mr. Gupta also said, can be given to people which is commensurate with the requirement of a social aspect of that individual, which may be rural, as you said correctly, which may be urban, semi-urban localities which are not very prosperous. So I think the need would probably be varying to different kinds of people who require this care. It's not always equal. The social systems do not allow us to be very uniform, and that is the reason we're not able to, provide trainings which are commensurate with the requirement of a certain social order. And for that reason, I have this feeling that there is a very...
It is our honor to introduce our chief guest, Sri Harsh Gupta. Dr. LPR with the respect, Sri Harsh Gupta. A 1997 batch IAS officer of the Karnataka cadre, Sri Harsh Gupta brings nearly 3 decades of distinguished service in public administration. With a strong academic foundation, including a master's degree from the India. He is a highly respected cardiologist with extensive experience in interventional cardiology, director of cath lab services at Narayana Health City, Bengaluru. Over the course of his career, Dr. Mehrotra has performed Thank you once again. May I invite Dr. Vasant, medical.
Bangalore's second facility we are opening, 120 beds, skilled nursing facility. Mainly it's covered at OP services, physiotherapy and adult vaccination. And there's a center of day care, transitional care, palliative care, and the post-acute hospitalization care we are providing. And I think it's a fantastic, it's a very good, it's a physiotherapy department is there, rehab and physiotherapy department is there. And full-time it's a clinical psychologist and it's a geriatrician lead organization. And it's round-the-clock doctors available. And I think it's mainly it's daycare services and short stay and long stay they are continuing.
ಇದು ನಮ್ಮ ಎರಡನೇ ಫೆಸಿಲಿಟಿ ಆಗಿದೆ ಜೆರಿಕೇರ್ ಬಂದು ಬ್ಯಾಂಗ್ಳೂರಿಗೆ ಜೆರಿಕೇರ್ 8 ವರ್ಷದ ಹಿಂದೆ ಚೆನ್ನೈಯಲ್ಲಿ ವೆಲ್ ಎಸ್ಟಾಬ್ಲಿಷ್ಡ್ 5 ಇದೇ ಥರ ರಿಸ್ಪೈಟ್ ಕೇರ್, ಟ್ರಾನ್ಸಿಷನ್ ಕೇರ್, ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್, ಪ್ರತಿಯೊಂದು ಹಾಸ್ಪಿಟಲೈಸೇಷನ್ ಅಂದರೆ ಪೇಷಂಟ್ಸ್ ಯಾರು ವ್ಯವಸ್ಥೆ ಮೆಡಿಕಲ್ ವ್ಯವಸ್ಥೆ ಬೇಕಾಗಿರುತ್ತೋ ಎಸ್ಪೆಷಲಿ ವೃದ್ಧರಿಗೆ ಅಂಥವರಿಗೆ ನಮ್ಮಲ್ಲಿ 24/7 24 ಗಂಟೆಗಳು ವೈದ್ಯರು ಮತ್ತು ಶುಶ್ರೂಷಕರು, ನರ್ಸ್ಗಳು, ಕೇರ್ ಗಿವರ್ಸ್ ಅಂತಂದರೆ ಸ್ಪೆಷಲೈಸ್ಡ್ ಕೇರ್ ಗಿವರ್ಸ್ ನಮ್ಮಲ್ಲಿ ಅವರಿಗೆ ಶುಶ್ರೂಷಣೆ ಮಾಡ್ತಾರೆ. ಆಮೇಲೆ ಫಿಸಿಯೋಥೆರಪಿ, ಕಂಪ್ಲೀಟ್ ಬೆಡ್ ರಿಡನ್ ಪೋಸ್ಟ್ ಹಾಸ್ಪಿಟಲೈಸೇಷನ್ ಕೇರ್ಗೆ ವೆಲ್ ಎಸ್ಟಾಬ್ಲಿಷ್ಡ್ ಟ್ರೈನ್ಡ್ ಕ್ವಾಲಿಫೈಡ್ ಫಿಸಿಯೋಥೆರಪಿಸ್ಟ್ ಇರ್ತಾರೆ ನಮ್ಮಲ್ಲಿ. ನಿಮಿತ್ತ ದಿನಗಳಿಗೆ ಅಂದರೆ ವೆನ್ ಪೀಪಲ್ ಆರ್ ಟ್ರಾವೆಲಿಂಗ್ ಔಟ್ ಸ್ಟೇಷನ್ ಅಂಥವರಿಗೆ ಕ್ರಮೇಣ ಶಾರ್ಟ್ ಟರ್ಮ್, ಲಾಂಗ್ ಟರ್ಮ್ ಆ ಥರ ಸರ್ವೀಸಸ್ಸು ನಮ್ಮಲ್ಲಿ ಕೊಡ್ತೀವಿ ನಾವು.
Dialysis facility where we have dialysis in-house, so patients who require dialysis don't have to travel. So 80 and 90 plus years who wants to have dialysis can stay here, take the dialysis, and being seen by a geriatrician and nephrology team, and they can maintain that quality of life. We don't want dialysis patient to just stick to a hospital and in the travel time anything can happen. So for that, this is a more ideal solution where they can take part in the community, where they can be with other patients, spend their time, take part in activities, as well as come for dialysis, so that they won't feel like they are stuck to the hospital or frequently visiting hospital. So this is first of its kind, and we require your support to take it forward.